Welcome back to Dental Ethics, this time polishing the framework. And yes, the pun is completely intended there for my dental colleagues. I'm your instructor, Scott Irwin, and again, I'm a dental public health dentist, and we'll pick up where we left off after the last discussion. And this time we'll apply the principles from the last presentation to applying it to a framework for ethical decision making. So our overview for today is pretty straightforward. We'll be presenting the framework as well as applying a scenario to the framework. And a very brief review in case it's been a few days since you last watched the other presentation. CODA requires that ethics and professionalism be a part of postgraduate dental programs that are accredited through CODA. And part of this is academic environment, research, patient care, practice management. And again, an emphasis on using professional codes, regulatory law, and ethical theories to guide that ethical judgment. And the topic of this particular module is practice management. We won't be discussing the others. So the scenario for this, as well as for your discussion post, will be practice management based. And again, just a reminder, you're asked to make an ethical judgment or take an ethical action, and we want to remind you that you should rely on some professional codes, regulatory law, and ethical theories to help inform that decision. Now for the framework. It's called 4 Steps to Assist in Making an Ethical Decision, but I put 4 in quotes because in essence there are actually 5, one that often gets overlooked, but it's one of the most important pieces of the process. Step 0, and that is getting all the facts. This is a highly critical component, as you'll see during the discussion. Sometimes it's impossible to get every single fact. Sometimes as you work through the process, you realize that, I think I need some more information. But step 0 really is getting as many of the objective facts as you possibly can. And then formal step 1 is identifying alternatives. This is essentially the heart of any ethical dilemma in the sense that you're often presented with different choices, and they're often difficult or unclear choices. This is what differentiates an ethical dilemma from an integrity issue. With ethics, you have to make a tough decision, and the correct decision isn't always the clearest. With an integrity issue, it's the opposite. The answer is pretty clear of what to do. The difficulty lies in actually doing it. So for this framework and ethical decisions, identify every course of treatment that might be possible. What are the different ways you could handle the situation? Is there a different approach to use each time? And I would caution you, don't let your own ways of habitually thinking or your own biases cloud your judgment here. Try to keep as open mind as possible. That's part of getting all the objective facts. Step 2 is determine what is professionally important. Now, within the framework of professional ethics and professional codes and regulatory laws and ethical theories, what is the primary concern in the particular situation? Is it something dealing with patient autonomy? Is it a fairness issue? Is it a do no harm issue? And this will depend greatly on the situation as well as all of the facts, which is so important to get all the facts. The third should be considered, but it may not always play a significant role. The third step is what else is ethically important. And here a good way of thinking of this is, are there other ethical principles involved? Oftentimes in other discussions, I'll use the example of a child that needs some sort of care and the parent doesn't want that care to be rendered. You're trying to work probably in the patient's best interest, and so you want to do good, so you want beneficence, or maybe you're trying not to do any harm based depending on the situation. However, it's a child, and therefore the guardian has legal say in the matter. The patient itself doesn't have autonomy, but legally you have to do what the parent says. So that may not be in the best interest of the child, but you have to respect the parent's legal position as guardian or parent. So now you have different things at work. What's best for the child versus the parental autonomy over the child. And fourth, decide what ought to be done. This is often probably the most difficult part because it requires you to commit. Here you basically rank the alternatives that you have, consider all of the other things involved, the ethical codes, Regulatory law, does that help guide the information? Decide what ethical theory you're applying here. Most people tend to lean more towards one or the other at any given time, but you can also flex back and forth between them and ultimately come to a decision that you can justify based on all of the other principles. So now we will take this framework and apply it to a particular situation. And here we have Roger who presents with severe pain in the upper right, particularly numbers 3, 4, and 5. You can see from the mouth that he clearly has a lot of other issues going on, but he's come to you today with pain on the upper right. You've taken a radiograph, some PAs, maybe you took a pano, and you can see abscesses up there. He has the telltale signs of infection. He has some infected teeth and retained root tips and infected root tips. And he's asking you, Doc, please do something. And by the way, Roger, he has insurance, which is the Medicaid insurance. It's public insurance. Now, just a little bit of background here, and this is part of your fact finding, is that Medicaid has some challenges when you work with it. State and federal funding is what basically funds Medicaid, and therefore it's state dependent. Each state will have its own level of coverage, its own type of coverage, and its own benefits that are covered. That coverage fluctuates year to year. This depends on political wins, who's in charge, state funding, what the general attitude is towards public insurance at any given time. So whatever applied last year may not apply this year. So you have to stay current on what those are. And then there are rules and policies often not compatible with optimal delivery of healthcare within Medicaid. They have traditionally been very restrictive, very emergency oriented. They're more generous for children, but for adults, they're kind of all over the board depending on what state you're talking about and what year. And by the way, in this scenario, you are a contracted Medicaid provider, meaning you've signed a contract with Medicaid to provide care at the rates that they offer. So in this particular scenario, at this time, Medicaid only covered exams, radiographs, and emergency or palliative care, including an extraction. Now, per Medicaid rules, they only allow one tooth to be treated per visit in this situation. The provider or you is not allowed to charge the patient the difference in the fee. So say Medicaid pays you $80 for an extraction, but your fee for an extraction is $150. You're not able to charge that other $70 to the patient. The patient's allowed to pay for non-covered treatment, but extractions are a covered treatment. So the patient may not be able to pay for other extractions because it's actually considered a covered benefit. And you, like I mentioned, you have signed a contract agreeing to Medicaid fees. Now let's take this and apply it to the framework. So getting all the facts, and I will preface this with not every single fact may be presented here. You can come at it from any given time, even different years you could present this and might have different facts involved. So certainly you'd probably want to consider the patient's information. You'd want to get a history of the situation. I mean, their chief complaint is pain. You might want to know how long it's been going on, what's previously been done to those teeth, what's his usual visit history. Is he seeks emergency treatment only? Has he ever had a dental home? Has anybody else addressed these teeth in recent days or weeks or months? What's his preference? What would he like to have done once he's presented with options? What is his work schedule, or does he work? Is he able to come in multiple times if, in fact, Medicaid only allows one tooth to be extracted per visit? And what is his overall understanding of the situation? Does he even understand what his Medicaid benefits say? He may think that he has insurance and that's good enough, and you should just be able to do whatever you need to do. Also, get your office's input. What is your current access to care and appointment availability? Should he need to be seen 3 times, can you accommodate 3 appointments in a close time span for him? What are your own values? Which ethical theory would you follow here? And then I mentioned, in terms of getting all the facts, certainly look at your regulatory law. If you're a Medicaid provider, you can go to your Medicaid contract and see what it has. Hopefully it's up to date. Here I just put a little screenshot, like the Texas Medicaid system. And in the very first line, it refers you to Medicaid dental services rules can be found under, and it provides a link. And there are several other links. So it might be well for you or your staff to click on that link and follow just what kind of guidance can they provide in this particular situation. What does the contract actually say and guide you to be able to do? Now moving into step one. Step one is identify the alternatives. Here, as we mentioned, alternative courses of treatment, how could you approach the situation and whatnot. And I would remind you to keep an open mind and consider all possibilities. So what I did here was put in some suggestions. Would you extract all 3 teeth at once? Would you extract one and reschedule the others? Maybe extract 1 tooth per day for 3 days? Maybe you could submit a pre-authorization for all necessary extractions, including the others in his mouth, to Medicaid, and see if they'd authorize a surgical visit where you could remove all teeth that needed to be surgically removed. Maybe you would refer him because you don't have time in your office for the coordination and the paperwork and all of those types of things. I've also seen providers just flat out say, the Medicaid list was not updated and I no longer participate in it and I shouldn't have been listed as a dentist that you can come see. Oftentimes in many studies, we find this to be either true in the sense that Medicaid does provide inaccurate lists at times, or I've seen dentists behave fairly unethically and just lie to patients and say they're not taking Medicaid, even though they actually are currently a contracted provider. So we've had some problems with that type of coverage in the past. And certainly you'd also want to consider your ethical theories here, consequentialism, as we had discussed in the last module, as well as deontology. Are you focusing on the best outcome for the patient, or are you focusing on following the rules because you've got Medicaid and your dental license involved? Moving to step two, determine what is professionally important. Now here I went ahead and put in some suggestions. Beneficence. Are you working to do well for this particular patient, and maybe in your mind you want to do well for all Medicaid patients with this type of insurance, and you're just going to do whatever it takes to get the best outcome immediately. And if that means taking all 3 teeth out at once, it means taking all 3 teeth out at once. You don't want to do any harm. Maybe you don't want to delay the patient. Maybe their work schedule says they can't come in quickly and they're walking around with infected teeth for a period of time because they can't be seen soon enough. Maybe it's a patient autonomy issue. The patient has to have a say in what they want done. And if you absolutely cannot satisfy that need for them, maybe you aren't the right provider for them. Maybe they need to go somewhere else. Someone who's willing to fulfill their particular desire or wish as to how their treatment is handled. And then keep in mind you take an oath to serve the public. That's part of the professional codes. Serving the public and acting in their best interest. But you also have a dental license. That dental license is bound by regulatory law, and breaking the Medicaid contract by violating it could cause problems. The third step, what else is ethically important? Again, are multiple um, principles of ethics conflicting here, or are they involved and may not work together or align quite as well as you'd like? Well, one thing I can think of is justice. Regardless of what you do, would you be able to provide the same care for all Medicaid patients, or are you only doing this for him, regardless of how you approach it? So, however you treat Roger really should be the same way you treat anybody else, especially another Medicaid patient. Now, certainly insurance policies may dictate that you would treat 2 different patients differently based on their coverage, but in the end, are you willing to follow all the rules necessary for one as well as follow all the rules as necessary for another? Or are you willing to bend the rules as required for patient outcomes? And finally, step 4, decide what ought to be done. And here I just wrote out a few thought processes involved. Considering all the alternatives, one choice, or maybe your first option, would be to go ahead and submit a pre-authorization to see if all necessary extractions could be done at one time. Now, maybe this can only be done if you can prescribe pain medication or antibiotics for Roger to buy him a little bit of time while you research it and see what Medicaid says. So if care could be delayed a little bit while you do the paperwork, that might be a good option because you could accomplish a lot of healthy treatment all at once. Another one would be extract one tooth per visit. This would fall very much in line with the Medicaid contract. They only allow one tooth extraction per visit. And if you could get Roger in 3 consecutive days, one tooth a week, whatever the case may be, you could do that and you would be falling well within the regulations for Medicaid in your contract and also keeping your license safe. Having a safe license means you can continue serving the public as well. So there's the legal obligation of Medicaid contract and avoiding fraud, maintaining your dental license, which helps you to continue to serve others, and you're more likely to treat all patients fairly and within the parameters of the agreement if you were to actually follow the Medicaid contract. So technically, this approach follows the deontology theory. Now, I don't want you to think that you go through all of this and then decide what theory fit. You really should approach it with an ethical theory in mind and see how best you can adapt it to that. But again, that depends on your own personal ethics and which theory you think applies best in this situation. So now that we've walked through all of those steps, it's going to be your turn. In the assignments, you'll find a scenario, and I want you to be able to apply the framework using ethical principles, regulatory law, and ethical theories in writing up your response to that. I want you to go through the assignment just as I did and take each step one by one and explain what you would do and what outcome you came to. Thank you, and if you have any questions, please feel free to email me.